Hello, everybody. Welcome to another Stories Inc. LinkedIn learning session. My name is Bernadette Van Giesen, and I'm your host. Today, I'm joined by my colleague, Peter, and we are here to talk about attracting and retaining healthcare talent in a tight labor market. Welcome, Peter. Welcome back.
Yeah, thank you for having me. Love working with this industry. So excited to have this chat with you today.
Yes, no, it is. Healthcare is always, a really special industry to talk about because doing such important work and the talent required to make that work possible. And it is kind of tough out there, the hiring market. It is a tight labor market. So I know we both really strongly believe that the stories you share and the recruitment marketing content that you're putting out there can really have a really impactful effect on the level of care that you're able to provide patients. So really important work.
And there's just so many great impactful stories from healthcare companies. I think too, it's just a great opportunity to showcase a lot of the things we'll discuss today.
Yes, totally agree. So to kind of set the scene a little bit, I pulled some stats. And a couple that I wanted to draw attention to that I thought were really noteworthy was first that healthcare and social assistance saw 588,000 quits in May, which is a lot. And I mean, that doesn't necessarily mean it's people leaving the industry, but it's people who did quit their roles and left their organizations. And that number is up from 519,000, which was the April statistics. So seeing that number of quits increasing. So I thought that was interesting to talk about. And then second, a January 2023 survey, so this year, of 18,000 nurses revealed that 30% are looking to quit their career. And that's up from 2021, kind of at the peak of pandemic burnout. And then of those who are planning to stay, 36% are considering changing workplaces. So just to put a couple numbers we're talking about today in terms of that tight labor market. So I have thoughts, but Peter, I'll let you go first. What do those numbers say to you?
I mean, a few things, right? Clearly, we are seeing a bit of a talent shortage in healthcare, right? People are leaving the profession, or just at least looking for new opportunities, right? But the other is that just there's that retention problem. So we also know that there's a lot of passive candidates out there who are likely open to changing workplaces. And I don't know, it kind of becomes a bit of a double-edged sword, right? Because it means ultimately that you need to really look inward at your current employees and double down on retention efforts to keep your talent at your company, right? But also shows if you are hiring, there's a lot of great talent out there. They're open to moving workplaces and probably want to hear about what you've got to say and could be convinced to join a healthy organization if the values align.
Yeah, no, I mean, nothing really to add. I think those are really great points that there kind of is no better time to talk to talent, both to keep them there, but people are listening. And there's a lot of, like you said, passive talent out there that is open-minded to hearing about other workplaces. So it's a good time to put that message out there and try to differentiate yourself in the market. So with that kind of scene set a little bit, going into our topic today, we're going to be talking about how healthcare companies can use employee stories in their recruitment marketing content to attract that passive talent and then retain their existing talent internally in this really tight labor market. We have a lot of examples that we're going to share throughout the conversation. We're taking a little bit of a clinical focus today. So nurses, physicians, doctors, we have some really great examples to share there. And
we know there's a lot more that make these hospitals, yes. Right? But yeah.
Yes, thank you. Good point. But before we kind of get into our examples and the different types of stories you can tell, I think it's worth just talking about why employee stories are such an important focus in your recruitment marketing content. I mean, for all industries, but especially healthcare. So
yeah, right. We've said it before.
We'll say it again.
It continues to be true, right? Stories prove, they're proof of your culture in action, right? Because These are rooted in real experiences. They go beyond testimonial, right, and actually bring it to life. In the context of healthcare, taking a story approach, I think, is especially important. This is a talent group. They've been overworked or burnt out, over the past few years, especially. I hear a lot, at least. There's been a lot of broken trust between clinicians and healthcare employers, so they're less likely to trust general statements and promises from your company, right? So leaning on your employees to bring your culture to life, share real examples, I think is the best way to build that trust with candidates and restore it ultimately with current employees that might be feeling jaded or whatever.
Yeah. Yeah, it's absolutely not enough just to say, we're going to have better hours or something like that. That you
Mhm.
have to say, like, here's an example of a way that we are creating more flexible schedules and making your life better. So having that story is really, really important, like you said, for building that trust. Okay, so we know we got to share stories, but I'm sure everyone out there is thinking, what kind of stories do I need to be telling? We have a lot of stories in our organization. We're creating really great impact, but what are the stories that are going to resonate with this talent group?
Yeah, I think, one type of story I think that works very well here, right, is connecting your work to your purpose, right? Um, One of the, I think great things about creating story content for healthcare is that you don't have to look too far to find examples of people finding their purpose in their work, right? It's everywhere. So ask your employees for examples of times they've been able to make a difference in patients' lives, as an example, right? And I'm sure you'll find a whole host of great stories to uncover there.
Yeah. Before we get into our first example, one thing I'll add that I also really love about these purpose stories is they typically reveal some other things about your culture too over the
Mm.
course of the story. So whether it's, like different clinical groups working together to be able to create a positive outcome, that kind of speaks to collaboration, how your team works together, or um, if it's someone being able to go, take time away from their day to be able to make a difference in a parent's life in the NICU or something like that, having the empowerment to be able to do that. Like, so it's like these stories also kind of share different things about your culture too. Which I would just, as a tip for anyone as you're uncovering these stories, look for those connections you can make to other parts of your culture too. So here's purpose, and then here's also why our culture, it allows these types of things to happen. Okay, so we're going to get into our first example. This one is from Children's Mercy. And so we have two different employees talking about how specifically in their role they've been able to make an impact in patients' lives.
I try to encourage new nurses to connect with families because when your career is over, no matter where that is in your life, you're not going to remember medications and lab values. The only thing you'll remember and take with you are the relationships that you made.
I'm bilingual. Children's Mercy has a program, Qualified Bilingual Staff, and I was able to become certified. I had a family that came up from the PICU. The parents spoke very little English. When I walked in that night to get report, the parents saw me and their face just lit up. They were like, oh my gosh, you speak Spanish. I love being that bridge to the language barrier.
There's always a handful of kids you'll never forget. I actually had a kiddo who was diagnosed with a brain tumor right around Christmas, and she was fairly young. She lost a lot of her hair because they had to shave her head on one side for the surgery. And I went in and her hair was matted. And they said, let's go wash our hair. Let's go to the beauty shop. And we did her nails. And it's those little things that add up to the big things. She finally felt like a little girl again. There's no amount of money that can replace that feeling of giving them something that in the worst time of their life made an impact on them. It's priceless. It's probably the most rewarding thing you can ever have. And Floor Nursing gave that to us. It gave it to me.
Really beautiful, very beautiful story.
For sure.
So just, looking at those two stories, I think they're very different, but they both are personal examples from team members of how they directly have been able to make an impact. And then in terms of what they also say about the culture, I think that first example, it speaks to a specific program that Children's Mercy has in terms of having language assistance to patients, getting certified as a nurse and as a healthcare practitioner. And so seeing that she was able to take advantage of that course and be able to make an impact, I think also just not every hospital probably has that. So I think that's something distinguishing. And then the second story also, sorry, my notifications.
Is that yours or mine? Okay. It's looking around for me too.
Just turn them off. And then that second story there, it also shows some of the other ways that they're able to support patients. So having that beauty parlor there and empowering team members to be able to take time out of their day to create those moments for patients is really special.
Mm-hmm. Yeah, and that passion sticks with you, right? Like you watch that, you remember that, right? So it's going to have some sort of effect, I think, on the audience you're looking to reach here.
Absolutely. Okay, so that is the first type of story that you really should be putting out there to your audiences, is connecting them to that purpose. So sharing internally, maybe reminding them why they joined healthcare in the first place, kind of relight that fire under them, and then externally showing candidates, this is the type of purpose you can find here. So that's story number one. What is story number two? What do we got to be talking about?
Yeah, I think sometimes you've got to address the elephants in the room, maybe the negatives, if you will, right? And I think one way to do that, right, is just to align your messaging with candidate pain points that exist, right? Things like, specifically in the healthcare industry, things that we hear, right? Can their employees feel overworked, or there's inflexible hours and shifts happening, or too much administrative work that takes your time away from the patients. It's what, again, maybe is actually your passion at this job, right? So, okay, of course, you only address these things if they're true, if it's what you're hearing, from your team. But if your organization has taken proven steps to address these pain points, right, then uncover stories that show how employees are positively experiencing aspects around these things, right? So how they appropriate workloads, or do you have flexible hours or shifts, and define sort of how that works, or does your organization take burdens of administrative work off of clinicians' shoulders, and that do allow them to focus on their patients, right? So try to find these stories that we know ultimately are going to address some of the pain that we feel out in the marketplace.
Yeah, and when you think about it really from like a talent standpoint, these are the reasons why people are looking for new jobs. So it's like they're saying, like, I am just constantly getting put on night shifts that I didn't sign up for, and I am working too much overtime. I need to find a place that guarantees me more stable hours. I actually just had a conversation with a friend of mine who has literally just made this decision in healthcare and nursing, that she was having a hard time with her schedule, and she found another place that was able to better accommodate that. And so it's like, this is why they're looking. And so create the content that answers that question for them before they even have a chance to ask it. So they can see that initially when they're researching your career site, when they're following you on social, they can get those answers, which makes them an even more excited, active candidate. So we have another example here. So this one is focused on physicians, so doctors. And it addresses the pain point of the administrative burden and how the organization is able to take that off of them.
At Ochsner Health System, they make it easier for me to do my job. They come to us and figure out, hey, what do you need as a physician, and how can we make that happen? There's not a lot of bureaucracy in terms of taking care of patients.
We as physicians are the ones that know how to deliver the health care. Frequently, we need the help of our administrative partners to figure out, okay, how do we create value for our patients?
I feel supported in not having to waste my time and energy on things that I'm not responsible for. And so it's nice to have someone to call and to help out with those things so that I can focus on patients when I'm here and be punctual and efficient, and then I can go home to be with my family. We all went to medical school to take care of patients. I don't know of any doctor that went to medical school to say, I cannot wait to manage employees and run an IT department. And so it's been nice to focus on what I was trained to do, which is patient care.
I think that they do a great job of letting me take care of patients in the very best way that I know how. So I think that's really unique to Ochsner.
Great one. And right to the point of what we were discussing.
Yes. No, absolutely. And I think the one woman who, says, I don't know anyone who goes to medical school to run an IT department. Like, you know what I mean? It's like it feels like a no-brainer, but that is challenges that physicians, everywhere are facing and having to, take on additional administrative workloads that they just don't have the bandwidth for. And then kind of connecting it back to the purpose piece that sometimes gets in the way of being able to deliver exceptional patient care. So if your organization is doing a good job like Ochsner of taking a lot of that burden off, it's really, really important to make that clear to talent.
Awesome.
Yeah. Oh, and one other thing I'll add I like about this one is that with it being a compilation video and having multiple storytellers kind of like speaking to that same topic is very, very compelling in terms of like, it's not like a one-hit wonder. It's happening across the organization for everyone.
Exactly right. It makes it a lot more impactful and allows you to really believe, right, that this is something that is pervasive throughout the organization. It's not just one person feeling that is treated that way. Meanwhile, there's hundreds of others off the screen, right, that are not. It's great to have those compilations to show again that it affects multiple people throughout.
Yeah. Awesome. Okay, so that's storyline number 2 of aligning your stories with candidate pain points. What is our third and final storyline here for healthcare talent?
I mean, you've got to find just ways to differentiate yourselves, right? Express what differentiates your organization from others, right? Use the employee stories to show what talent has to gain, by choosing your workplace that they can't get anywhere else. This could be, some of the stories that we've already discussed here, right? It could be, something completely different. It could be, acts of community service that your particular unit, does once every quarter or whatever it is, right? But highlight these things that you maybe don't hear, or you spoke to people at your organization. We didn't do this, where I last worked, right? Well, those should be stories I think that should be shared because again, it just paints you in a unique light.
Yep, totally agree. So we're going to share our last example here, and this one is from an early career nurse, and it was captured in 2022, so during the pandemic, and her talking about her experience as an early career nurse and why she chose and loves her particular hospital.
Things that really drew me to this hospital was that it is a teaching hospital, so the employees are used to having students and new employees that need to learn, and they're very patient and they welcome you with open arms. A new nurse needs a very healthy learning environment. I think it's something that we should put more stress on because as a new nurse, I have experienced a great deal of stress and anxiety that I never had experienced before, and just knowing that I had the team that I do around me really was what helped me push through. When I was a student, that is kind of what drew me to the PICU was the nurses and the teamwork. I never have gone into a patient room alone with not someone there beside me to help give me some of that confidence that a new nurse needs.
Short and sweet, but I think especially if you are an early career nurse out there, you would hear that and say like, oh, like I wouldn't get that everywhere else. Like not every hospital is a teaching hospital. Not every hospital has a staff that is equipped, prepped, like mentally ready to bring someone on who's a first-time nurse and kind of like hold their hand through those initial months. And I think that's a really important story to tell those early nurses.
Yeah. Go LSU Tigers.
Awesome. So those are our 3 storylines. We made it. To quickly summarize, in this tight labor market, you need to use your employee stories to bring your culture to life and attract and retain that talent in your organization. So you're going to do it with 3 different types of stories. First being communicating purpose, so how the work that your team members do directly creates an impact on patients. Second, you're going to align your content to direct candidate pain points, so things like administrative burden, inflexible hours, things like that. And finally, you're going to find those aspects of your culture that are very unique and different and that not every employer can offer. And you're going to bring them to life and put them in the spotlight in front of the audiences you care about most. Sound good?
Sounds good to me. Yeah, we've seen it, right? The numbers are out there. There's people, if they've left jobs, that means there's people looking for jobs, right? There's passive candidates out there and they can be convinced, they can be attracted, right? If you share the right stories that align with the right person, right? And you never know when they're going to be looking, when that person, might be, have some downtime to be perusing, for job opportunities. So again, I really can't stress it enough. Like, this sort of content really does resonate, I think, and can provoke action.
Great way to end it. Awesome. Well, thank you everyone out there for joining. If you have any questions about Stories Inc. and how we support employee storytelling content creation, shoot us a comment, come to our website. We would love to help. But thanks for joining, and we'll see you next time.
Bye.